early in the month, we had a verbal discussion with management of Onward Hospital that there was some internal restructuring going on in the hospital, and the inflation has affected their practices, and that they want to withdraw for now from OI's activities. Okay, I asked them to put it in writing that we want to do that. Normally what we do is that at the beginning of the month, we pay capitation. That's an advance payment. That we pay capitation that people that will be coming for treatment this month, they have paid their capitation in advance. So we told them, well, when they wrote the letter to us on the 10th of June, we told them that it is not possible to stop treatment immediately since we have given you an advance payment of capitation for June. So the only thing you can do is that we can give you the concession that because of what, because the MD, Baba, personally came to me and I said, "You're my elder, that I will give the concession that instead of that 3 months, by the end of June, what means that we will not pay the July capitation, that we can stop the services." And they were grateful for that. It's just unfortunate that we just had it everywhere, that it was because the government was not funding OEs and people and hospitals were not getting capitation, and that was why Onward. And of course, we made a press statement after that no, the withdrawal of Onward should not be politicized. They gave us a reason why they want to, and they also said in the letter that they will be willing to come back when things are more stable. You understand? So we don't see any reason why anybody should politicize hospital for that. And even beyond Onward, this year alone, we have received more than 20 applications from private hospitals that were not with us before that have shown interest in joining OEs. So if it has not been a viable scheme, I don't think people will be thinking of joining OEs. I said the other time, that's the second question, that the total enrollee now is 200, I see 267,000. 267,000. That's the total number of enrollee now. Can the service provider pull out anytime? We have just addressed that. And when the grants from federal government, usually, because federal government is more concerned about the primary health care, primary health center, and the grant, they normally prorate it using all what we have received till date this year is 186 million. That is all that we have received for we call it Basic Health Provision Care Fund, primary health care. So that's all what we have got. So that's because I don't know where the 4 billion that is quoted is coming from. You understand? And the federal government, once they give the fund, they give the directive on how to spend it. You cannot go beyond what they have asked you to spend. You cannot spend it on an extra Bible. That is not allowed. And if at the end of the year, whatever that is remaining, they take it back. Oh, sorry. Whatever that is remaining, they take it back. They will specify, give you the money and specify how they are going to spend it. Before I came in, we have, in fact, I don't want to say because we have addressed it, issues of capitation that were owed these primary health centers. I met an arrears of 13 months unpaid capitation to primary health centers, and the federal government has given us the money. But we did not pay them. The fee for service we did not pay. These were running into several millions of naira. And when I came, in fact, federal government raised a query for us. I didn't commit the infraction. I had to go to Abuja to explain. And these were the few money that I have to clear when I came on programs. Now we are on the clean sheet with anybody, whether private hospital, whether primary health centers. All the fee for service that were owed, that were also running into millions of naira, we have cleared. In the fund given by the federal government to these PHCs, capitation, fee for service, monitoring and evaluation, ICT administration, they specify how much you are going to spend. 5% for this, 7.5% for this, and there is even a reserve of 5% that you must keep in case of any unforeseen situation. So that's usually the way it is. So all our enrollees that don't have their complete details with us, let them come so that they can update their details, that we have complete database for them. It is very important. Then the capitation, we are not owing Onward a dime. We are not owing any provider a dime. In fact, what we do now is that we pay capitation in advance. What happened is that if you have 1,000 enrollees, you understand? If you have 1,000 enrollees, our tariff is 570 naira per person per month. You understand? Whether this 1,000 enrollees go to the facility or not, we pay this 570,000 naira to that facility. You understand? Yes, that's why I said 570,000 if it is 1,000 enrollees. So whether those people go there or not, you understand? There might be yes, for Onward Hospital, we have 3,411 enrollees as at now in that hospital. What that translates is that we multiply that by 570,000, we give them every month 1.944270 million statutory. You understand? So whether the enrollee goes there or not. Now it's an insurance pool. In a whole month, one person might not go. So that becomes the profit for that hospital. And in some, 100 people may go, 200 people may go. You understand? And every month we ask for the encounter details of each hospital so that we know the utilization rate of such an hospital. Now, this is just outpatient treatment. That you go there, you have headache, you have malaria, they treat you. You have upper respiratory tract infection, they treat you. It does not mean admission. If for any reason such patient is admitted, that has become secondary care. At the time of discharge, they will send the bill to us and we will pay. We will verify what they have used and we will pay the bill. So, in addition to capitation, we don't deduct that from the capitation. So that has been the standard practice. And you see, despite the number, it's quite unusual. Even people who have 200, 300 enrollees, they still say they still express thanks, appreciation to us for what we are doing. You understand? And that was why I told you about when you called me that look into the system very well so that we can see. When I came on board too, I saw some areas of leakages. And once you block those areas, things will become vibrant. You understand? I don't want to explain beyond that level.